How the patient who was diagnosed with Ebola in Texas caught the virus in Liberia. The first man to be diagnosed with Ebola in the U.S. has been identified as 42-year-old Thomas Eric Duncan, who flew in from Liberia, where he had helped a woman that was infected with the virus. The New York Times reports that while in Liberia, Thomas Eric Duncan had recently helped a pregnant woman infected with Ebola to the hospital, riding with her and her family in a taxi. However, due to lack of space, the woman was turned away from hospital and sent home. The Times reported that witnesses saw Duncan help the woman's father and brother carry her back into the house. Days later, Duncan, who was not showing symptoms of the virus, passed health inspection at the airport and flew from Liberia to Texas. On September 26th, Duncan sought medical treatment at hospital for a fever and abdominal pain. He said he had been to Africa, but that information was not communicated to the rest of the staff. He was prescribed antibiotics and was sent home, only to return in an ambulance 2 days later. Meanwhile, authorities say between 12 and 18 people in Dallas have been in contact with Duncan, including 5 school-aged children. However, none of the students have presented symptoms of the virus so far.
Get the TomoNews mobile phone app, uncut and uncensored. Search for TomoNews in the Apple App Store or Google Play, or see the links in the description of this video.